Welcome to this edition of the May 25th, Monday's Media Advisory after a spectacular long weekend and a great Monday. Hopefully, you're all able to safely enjoy the great weather out there. This week is Paramedic Services Week, an opportunity to recognize the tireless work and dedication of our paramedics. The theme this year is Pandemic Paramedics on the Front Line. And no surprise, it speaks to the very important role that paramedics play in the front lines of the healthcare system during this pandemic. And it's all done under the great leadership of Chief Mike Sanderson and in partnership with our many healthcare sector partners. Our paramedic service has been working hard during this pandemic and always to ensure that our residents receive the best possible care in the time of urgent need. I want to recognize and thank all of our paramedic staff for their tireless dedication to their work in serving the people of Hamilton. Great reminder as well to look after your underlying health issues. If you need medical attention, please reach out and seek the care you require. Don't neglect to reach out due to the COVID-19 concerns. Paramedics and frontline workers are available and ready to help, and they have all the necessary safety measures in place to do it for you safely. So do call out for those that need health care. Make sure you connect with our paramedics and your doctor or emergencies. All of them are there, ready, willing, and waiting for you to look after you. Some announcements from our federal government just recently before I share the announcements from our Greater Toronto and Hamilton area mayors and chairs. We met virtually today to discuss again the ongoing response to the COVID-19 pandemic. We remain united in confronting this virus in our communities and making sure we do everything we can to help residents and businesses get through this emergency. We continue to advocate to the federal and provincial governments, however, for municipalities to be supported when it comes to the cost of confronting the COVID-19 in our communities and the need to properly restart our economies. So we're encouraged that the province and the federal government have begun discussions about supporting municipalities, but we need them to follow through with a financial commitment to municipalities as soon as possible. Some major service reductions could result if we do not receive the support from the federal provincial governments very soon. So we remain committed to working with the province and public health across Ontario to help shape phase two and ensure it works for local communities based on local public health conditions. So now back to the federal announcements. The Canadian Emergency Commercial Rent Assistance Program is now being accepted for small businesses. Property owners will reduce rent by at least 75% for the months of April and May, retroactively in June for their small business tenants. The CECRA will cover 50% of the rent, with the tenant paying up to 25%, and the property owner forgiving at least 25%. The program is another step or measure to provide relief for small businesses experiencing financial hardship and certainly will help keep employees on the payroll. The provincial government has announced they are now allowing asymptomatic people to be tested for COVID-19. And I think Dr. Elizabeth will have something to say about that in a little bit. Of course, our medical officer of health has initiated a heat warning as of today. Warmer weather is expected to happen throughout the week. So due to the pandemic, we have to go with a modified community heat response plan for this heat season. So under provincial orders, spray pads and indoor and outdoor pools remain closed. However, we have been able to work with our partnering community agencies to respond to the heat by offering a cool place to go during all stages of heat event. And these locations can be identified by a cool down here sign at the entrance. Today, we're opening 6 city recreation facilities serving as cooling places, and some library locations are coming online over the next couple of days as well. We selected these sites that we felt would best serve the broader community and need, where we could implement the necessary public health measures such as physical distancing. So for up-to-date information on the city's heat response, cooling places, locations and addresses, and tips on coping with the heat, visit www.hamilton.ca/heat. We saw over the weekend in neighboring communities that physical distancing and not gathering in groups continues to be an issue in local parks and other locations. Remember that we have to stay the course on physical distancing, hand washing, and wearing face coverings when we go out to run errands if at all possible, and not gathering in groups of 5 or more people. All of that remains in effect. And a reminder that city amenities continue to be closed at this time. Amenities like sports fields, park benches, and playground equipment, escarpment stairs, city waterfalls, and decorative drinking fountains all are still closed and in review by our public health. We're continuing to look at the provincial announcements of last week, allowing some other outdoor recreational amenities to open, such as sports fields, park benches, picnic areas. We will have more to share on these very soon. So staff are reviewing what needs to be put into place safely to reopen these soon. The city's Hamilton Reopens plan is now online as part of Wednesday's council agenda. It'll be presented by our EOC Director Paul Johnson, with participation as well from Dr. Richardson on Wednesday. So please tune in for that at our council meeting starting at 9:30. And on that note, I'll pass it on to our Emergency Operations Center Manager, Paul Johnson, to give us any updates from the EOC. Paul?
Thank you very much, Mr. Mayor. I want to start with some comments you made about this being Paramedics Week, and thank the great job our paramedics do. In my normal role with the City of Hamilton as a General Manager of Healthy and Safe Communities, obviously our paramedics chief sits around our leadership table, and I've gotten to know both him and many of our paramedics well, and really respect the work. Mario Pastorero, who is the head of the union for our paramedics too, he and I have gotten to know each other over the time that I've spent as general manager, and I want to share my congratulations for the work that he does on behalf of his members in supporting us to have the very best paramedic service. They are starting to see more calls for service on a regular basis, and that, alongside all the work they're doing to remain safe during responding to calls that may include people who are COVID positive, continue to put a big strain on to our paramedic service. So I just want to wish them well, celebrate this week alongside you, though in a very different way, all virtual right now. So thanks for that. I do want to commend our EOC for their work in accelerating an actual response to the heat alert. Of course, looking at the long range forecast, it wasn't anticipated we'd get into heat alert territory, but then that changed over the weekend, and we were into some very heavy temperatures. So congratulations. I would remind the public these are really meant just as cooling centers for people who need to cool down. Our rec facilities are not open. There are not going to be activities. So don't come out in terms of a more social place to be when the weather's warm. For those who need it, who need a place to cool down because they can't in the place that they reside, be that in a situation of homelessness or be that in their own living situation, certainly they're there for you. But this is a very different year for a lot of things that are often in place. And in previous years, our cooling centers were also in great places where you could do other activities. This year, it's really going to be all about just making sure people stay hydrated and stay cool, because of course that can take a toll on people in and of its own right. So they're very utilitarian right now. It's a place to come and get cool, to get hydrated, to make sure you're okay. And do not try and attempt to come to these centers if you are ill or you exhibit symptoms. The active screening will have you turned away, and you should really be reporting that, as Dr. Richardson will talk about, and making sure you're tested so you can have an understanding of whether you are COVID-19 positive or not. So at the EOC, we continue to monitor all of the work that's going on and respond to some of the provincial orders that are being lifted. And as you heard last week, we're doing this in a phased approach and a staged approach. So we've worked very hard to get certain amenities open so that people can start to enjoy things. But as the mayor mentioned, there are some things that remain closed. One of the things I'd like to highlight is I understand how much people want to use our escarpment stairs. I understand what a great place they are for not only getting up and down the escarpment, but also for a great place for recreation and exercise. They are closed. Unfortunately, over the weekend, we saw a fair bit of damage to the barricades that we've put in front of them as people are attempting, I guess, to use the stairs, even though we've been very clear that they're closed while we evaluate them from a public health perspective. I can only say that we've made sure that our bylaw folks are aware of that. There will be increased enforcement and monitoring of the stairs. So if you're thinking of just using the stairs because you think you should, there's a very good chance that you'll receive a fine for that behavior. So in time, we expect these amenities will come back online. That's our goal. But please recognize there's lots of good other spaces right now to use. And I understand if you love the stairs, then that's not a really great answer. But right now, you'll have to find some alternatives. And please respect the fact that we're just trying to do our best to open these as time goes on. And we've had some good response back. I expect we'll get lots of questions and have a good discussion about the reopening plan and sort of the roadmap for how things look over the next coming months on Wednesday. And as an EOC, we're happy to be in front of council and in front of the community. And then the day after in front of our own staff doing a bit of an internal town hall so our staff can ask questions about what life looks like in the coming weeks and in the coming months as we deal with this pandemic in our community. So with that, over to Dr. Richardson.
Thanks very much, Paul, and congratulations again on Paramedics Week to our paramedic colleagues. They do amazing work in often very difficult circumstances all year long, and during this time with COVID, they have been great partners in whether we're looking at testing for people who are, not able to leave the house, or people who are living in congregate living settings, and all the testing we've been doing in long-term care homes. They have been just fabulous partners, and so we're very grateful for their help and the good work that they do each day in our community. So this Monday, we have, as of 9 a.m. today, we have 647 cases here in Hamilton, 640 of those being lab confirmed, 7 are probable. Of those cases, 421 or 65% are resolved at this point. I don't have any new deaths as of this point today. We did, however, have some deaths reported over the weekend with 2 additional deaths in residents who had come from the Roslyn. One had passed away on the 20th of May. That was an 84-year-old gentleman. And on the 22nd of May, a 79-year-old female resident from the Roslyn did pass away. And our thoughts are very much with the families and friends as they grieve the loss of these individuals, unfortunately, to this disease. We do have 7 institutional outbreaks ongoing, no community-based outbreaks at this point. And of course, you can always find more details around those on our website. We've talked a little bit about the heat study today, but just to say it will likely be in effect until Wednesday. Having a heat warning during a pandemic is something, of course, we've never had to do before, but I think we've implemented a good solution that balances the need to provide cooling places with the need to maintain a safe distance from others. And as Paul has said, these are really meant for cooling places for those who are unable to find cool air to get that respite, that relief from the heat, not just as recreational spaces. I'm just going to talk a little bit about the expanded testing criteria. We did, of course, hear from Premier Ford over the weekend as he began to talk about the upcoming strategy to expand testing for individuals who are asymptomatic, those who don't have symptoms. And as part of that strategy, testing will be expanded to include people who are concerned they may have been exposed to COVID-19. So people who are contacts of or may have been exposed to a confirmed or suspected case of COVID-19, as well people who are at risk of exposure to COVID-19 through their employment. These are anybody who's an essential worker, whether it's a healthcare worker, a grocery store employee, gas station employee, anybody who's out there doing essential work or working in as workplaces expand open, who may, through seeing many, many people over the course of the day, have some exposure to COVID-19. The province is working directly with a number of partners. They're working with those who run assessment centers. And as you know, we run one here through primary care and the hospitals, and we assist in that as well. For those sites, we are continuing to book the appointments. It's just a better way for us to manage the number of people in line and to make sure people get through quickly. We know we do have a number of calls coming into that line today, and we're working hard to get through all of those and get people booked in. The assessment center team is looking at ways we can make bookings happen more quickly and look at how else we can continuously improve those assessment centers to provide the resources that are needed. But certainly if there is a longer term strategy. In this way, we're going to look with partners about what more we could do to support testing. The province is working as well with others. They're going directly to hospitals, other institutions, corrections to implement enhanced testing, and we don't have all of those details as of yet. They are working directly with those individuals, but we will absolutely be doing our part to support the provincial testing strategy as we learn more about it. On the Roslyn, there isn't much aside from those 2 additional unfortunate deaths that were reported over the weekend to report on that front. However, we did get mass testing completed in 4 of the homes that were associated with the owners of the Roslyn, and we haven't got all the results in yet, but in those that we do, there have been no positive cases found at all identified through that testing, so that's very good news. We did issue orders for 4 of the facilities as well, to Montgomery Lodge, to Dundas Place Retirement, Cathmar Manor, and Northview Seniors, to ensure that they're undertaking good infection prevention control strategies. And we did see, they were very responsive to those discussions, and as well to make sure that they are screening residents and staff. And so that is going well. We don't know in terms of the Roslyn per se, in terms of when anybody might be able to move back into the Roslyn. That's still all very much under discussion between the Retirement Homes Regulatory Authority, who oversee retirement homes across the province, and they have a number of conditions in place. And as well, we still have that Health Protection and Promotion Act order in place, and would want to see that complied with before reopening. So that's it from me, Mr. Mayor. I'm going to turn it back over to you.
Thank you, Doctor, and thank you, Paul, for your update as well. And just a couple of quick shout outs to some great groups and organizations in our community doing some great things. A shout out to Mohawk College instructor Leaf Peng, and is encouraging his students to create works of art expressing their feelings about the pandemic. To view the student art, go to Instagram and search We Cope Through Art. It's another example of creatively inspired by a crisis resulting in something positive. So thank you, Instructor Peng, and the students for the work that you're doing to create something positive out of something negative. A shout out to the teachers at Huntington Park Elementary School on the East Mountain. These teachers are taking to their bicycles to ride through the neighborhood to encourage kids who are studying from home due to the pandemic while their school is closed. So some positive reinforcement, staying connected with their students by maintaining physical distancing, but being in the neighborhood, talking with the kids, letting them know that their teachers care about them and are keeping an eye on them and helping them and encouraging them to continue on with their studies is so incredibly important. And we thank the teachers for taking the time to do that. Most of them are teaching from home, but that physical connection at a safe distance with their students reminds the students that their teacher cares and they've got their back. So I'm really appreciative of that. I'm going to go now to Jasmine to offer up any media questions as they come up. Jasmine.
Thank you, Mr. Mayor. We do have a number of media partners on the phone today. We'll start this afternoon with Bobby from from CBC Hamilton. Bobby, you can go ahead.
Hello, I hope you're all doing well. My question is, in terms of the cooling centers, do we know exactly how many people these cooling centers will be able to serve? I'm assuming that would have been part of the calculation in terms of the social distancing.
Yeah, it would have been. I don't have that number off the top of my head. I will tell you that generally speaking, our cooling centers, we don't see a lot of people coming, even historically pre-COVID. So we feel that based on historical numbers, there's more than enough. We also analyze where it's more likely that people may need access to this, proximity to those who may be experiencing homelessness, who sometimes need these centers, and fewer places where they may naturally cool, like malls, are available. So we did a bit of that work, but I can follow up with the actual numbers afterwards. I don't have that number to hand.
I appreciate that. Thank you. And in terms of the blockades to the stairs being damaged, and still seeing issues with public gatherings, what are your thoughts on that? Like what's it going to take to convince people to stop doing this?
Well, it's a good question of what it would take. I would think that as we head into week 11 of being under federal, provincial emergency order, and certainly the municipality, the mayor announced that a little later on in the process. But we have emergencies at all levels. We've seen the sickness and the illness and the deaths that occur from this. And I get, for some people, they're saying, well, that's not been near me. It's been in other places. It's been in other types of facilities. But I would think that people would understand that it's not our intent to keep things closed for some particular other reason other than we don't believe they're safe to open up just yet. And we were pretty clear when we talked about the stairs remaining closed that there are things we need to do. It is very tough to social distance with thousands of trips up and down those stairs. And then you've got the railings and everything else, and it's a bit of a canopy over the trees. So Dr. Richardson said, hey, I want to think about this a bit longer. I think that's perfectly reasonable. Same thing with playground structures and things, they remain closed. But we don't see the same kind of damage anymore at the playground structures. So I think that I will say that the vast majority of people are doing well. We didn't see, the same type of egregious examples that other communities saw. But this is just going to be that constant messaging of you need to stay physically separated. It is the way that we stop the transmission. You've heard Dr. Richardson talk about this time and time again. It's the people that are the carriers of this, and when we get too close, there's the possibility for transmission. Secondarily, of course, there could be surfaces of things we touch that we need to do, and that's about hand washing and not touching our face. And obviously, if you're sick, then you're not going to go out and enjoy those types of things. Stay home, take care of yourself, and get in contact with health professionals. I don't know how much simpler we can make it. I do hear sometimes people saying, well, it's confusing about this and it's this. Let me tell you, at the stairs, there is no confusion that they are closed. I've been by, and there's no confusion. So I think people just have to respect the signs and understand that we'll get there. It's about getting there in the right time to do it. And the things that remain closed are closed because we need to put protocols in place. We need to ensure that they're safe places. That's the only reason they're closed. It's not out of laziness or some sense that we need to keep them closed for another purpose. It is really about making sure they're safe when we do reopen. And we expect that more will be announced in the next couple of days. We're just working through those protocols, making sure everything is safe. But the stairs, I imagine, are a bit of a longer term conversation. So they may remain closed for a little bit longer.
Thank you. I hope you stay safe and healthy.
Thanks, Paul. Next question is to Manessa from CHCH. You can go ahead. Manessa, are you there? Okay, we'll go to our next question. Will be from Don Mitchell from CHML. Go ahead, Don.
Yeah, just quickly want to touch on, Doug Ford saying that testing is readily available. We've gotten a lot of phone calls into the radio station about how this actually works. And so there have been people that have been going up without appointments, which obviously they're not getting in, and they're being told that they have to make an appointment and return at a later date. But we've also had some that have had appointments, and this is just a procedural question. They've come in and they've gotten the test, and upon leaving, they've been told they have to self-isolate for 14 days. And we just want to double check, is that a procedural thing that they have to do?
Thanks very much. That's one of the things in redoing the strategy that all needs to be worked out. Essentially, as we started the testing that we did right at the beginning, going back to when it was first detected in Canada, we were asking everybody to self-isolate it because presumably if they were coming forward for a test, it was because they either had been exposed, they traveled, they were having symptoms, that sort of piece. And so they were being asked to self-isolate for 14 days until they either had a test back that was negative, because some at times, unfortunately, our ability to get those test results quickly has been rather long, or they needed to go forward because they had a positive test and continue to self-isolate. So these are some of the things when we get the full testing strategy, which we're expecting any time now, that we'll get those little items clarified. Because you're right, for those who are asymptomatic, who may not have had contact with the case, any of those sorts of things, it may no longer make sense for that to happen. But for many, many who come forward who are, again, contacts of cases or that sort of thing, it is still the appropriate thing for them to do.
Thanks, Don. Did you have another question?
I did want to ask just one last thing, and it was just a follow up to the Premier making the announcement about, go out and get a test if you can. Is the city ready for something like that? Because we've been getting, as I mentioned, we get calls, and so the calls we've been getting have been people who aren't necessarily showing any symptoms that just decide they want to go do a test. Is that recommended? Are we going to be able to handle that volume, or can you tell me about that? Did you know this was coming?
So we knew that the additional testing strategy was coming. It was going to be expanded. It would be there. A lot of this is being done through players other than ourselves. So it's being done through Ontario Health. It's being done through hospitals. It's being done through directly with workplaces and work sites. And so we don't have all of those answers at this point. So it might be helpful to go back and ask those questions of Ontario Health. They may have some more details, but we're expecting to see them soon. And we will continue to support the strategy as it rolls out.
Thanks, Dr. Richardson. Next question will be to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Hi there. My question is for Paul. I'm wondering if the city is worried right now that we might have a situation at some point similar to what we saw in Toronto at Trinity Bellwoods, and if yes, are there any plans to do anything to prevent something like that, either with bylaw officers monitoring, that sort of thing?
So I can tell you that we have seen an uptick recently in the amount of fines that have been levied for physical distancing. So you'll recall in the height of this, where we put this in place, so for a long time it was 1 or 2, and we're now up to about 16. So certainly there are more of these tickets being given out, and that is one way of doing it. The other thing that happens is, Dr. Richardson and I talk regularly about what would the situation be where we might have to look at some alternative measures. Ultimately, this is in people's hands. We have lots of space in Hamilton to physically distance, to enjoy amenities. It may be that you arrive somewhere and it just might be a little too busy, that one place, but there are other places to go and there are other ways to enjoy Hamilton. So it's completely in the community's hands. But as you know, you've heard the Premier say at times and our mayor say at times, if this can't work, then we'd have to look at other things, which we wouldn't want to go backwards in this. But it is really important that physical distancing be maintained, and when it can't be maintained, that we're wearing proper face covering. So I think bylaw plays a role in that, and we're beyond the education in most cases where it's clearly flaunting that. So you've seen a bit of the uptake in the number of tickets that are given out. But I will tell you, there's nearly 1,200 square kilometers here in Hamilton. There is no way that bylaw can be everywhere. We'll go to the hot spots. We'll see the things that we can see. But people need to just take this advice to hand, and we just need to keep monitoring it. My hope is that it's why it's done in these small phases, so that it'll regulate itself. People will figure out, yeah, we can go out and do more. And now, though, I need to not be in certain places because they're too crowded, or I need to figure out a different way to physically distance. So my hope is people will sort this out for themselves as they go on. And as I say, by and large, we're seeing very good compliance. The places that I went on the weekend, there were more people out, but I didn't see things happening which would have caused me to run back to my home office and give Elizabeth a call and say, I think we may have some challenges here. I think people are trying. We're just going to continue to put the message out that there are certain places where you're not to go. And it's because we feel those are places where physical distancing and gatherings are going to be encouraged, and we want to start to discourage that.
When you talk about alternative measures there, what might that look like? Like, would you consider closing green spaces in a park?
Well, that would be extreme, and that would, that'd be a decision that, Dr. Richardson and her team would have to look at and say, is there really no other way that we can protect the public health of the community? So those are the extreme measures that we take. I'm more of the opinion that with the hotspots and some extra enforcement that we put on, just to both educate but also enforce, and just keep getting the message out and out and out. And I would say that our media partners have been fantastic in terms of giving out those clear messages over and over again, that I think it will work out. So I'm nowhere near I mean, obviously, there are very few things we could do, and one of them might be to look at stepping backwards. That's certainly been the provincial message. It could be our message. I just don't think that's anywhere on anybody's radar right now. I think we're going to still encourage those messages, and have people do the right thing, and it'll work out. I'm confident of that, actually. And seeing what I see, generally speaking, around the community, I'm very confident of that. We've had now, more than a week of some pretty significant new things happening in our community. And the feedback I've heard, for instance, from our golf courses, from our golf operations, is that the golfers that came out were not, ignoring new rules. They were very respectful of, here's how you can golf appropriately. And as I say, in most of our green spaces and trails and walkways around the community, the same thing is happening. When I go out for my walks, people are very respectful of each other's space, and we're all doing the right thing. So I think we need to focus in on that. And then, as I say, where there are some problem areas, we'll deal with it. And the only one that really popped up as one that I thought I needed to say today is that we've seen a bit of that destruction of the barriers at the stairs. And I want to remind the community that those are definitely closed, and any use of them, it will not be education. It will not be a quiet word. It will be a fine given out. We want to keep those things closed for now.
Thanks, Paul. Next question is for Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. When I was listening to the Premier's press conference today, he announced that testing will be brought to hotspots identified by postal codes and large workplaces. So do you know yet where those hotspots are and what workplaces, and will you be bringing them to those places in a van, or like how will you be doing that testing?
Hi, Joanna. No, we're not clear on how that piece is going to roll out at this point. As I was saying earlier, a lot of the rollout of this is happening directly through other providers. And so public health doesn't, at this point in the city, we don't actually have the details on the strategy. We'll likely get those over the coming days, but it would be a good one to go to Ontario Health and ask them if they have further details on that.
Okay, thank you so much. Lastly, at that same press conference, the Premier was basically telling everyone who wants a test to go to an assessment center and get it. Do you have the ability at the assessment centers to do that testing at the same time that he's also saying he wants every long-term care home and staff retested, every retirement home, every congregate living setting? Like, do you have the ability to do all this testing, and how long will that take?
So I think it's, in talking about all the different providers that are being brought in to look at testing, hospitals, the assessment centers for sure. We know EMS has already been helping us with testing and will continue to be. And we know the province is working on many different channels through which testing can be done. So most of the testing to date has been done either through urgent care or the assessment centers, or sometimes when people are in emerge departments and admitted to hospital. And then there's been that mass testing that's been done in long-term care homes and retirement homes. So the province understands how big a job it is, and they're working on many, many different channels to get that testing done. At present, we're still working with our partners around the assessment centers, and we're still booking those appointments. It's likely we're going to see an uptick, and we are seeing an uptick in the number of people who want to go through those. And so we're looking at ways to continue to streamline and improve those clinics. So I think if we continue to see a large number of people, we're definitely going to need some additional ways of doing testing through those assessment centers, either another site or some way to lengthen hours, that sort of thing. So we're going to continue to work on it to see how we can do this. But there's a large number of other partners that are being engaged with this now, besides the ones that existed up till now.
Thanks, Dr. Richardson. Next question to Matthew from the Hamilton Spectator. Matthew, you can go ahead.
Hello, everybody. Paul, I'll take you back to the cooling centers if I could for a moment. Can you kind of walk me through how that works from a physical distancing perspective? I mean, are people allowed to browse the books in the library, or are they allowed to use the water fountains at the rec center? How does that work?
So no, we'll be providing water in different ways at the rec center, and I understand the environmental concerns around that, but we're going to take the safe approach with doing that type of thing. We're quite frankly not ready to open up facilities in a broad way, so we're going to do as much as possible to keep these as very. They're really going to be resting stations, and the physical distancing will be laid out in terms of where chairs are for people to sit in. These are going to be waiting rooms, essentially. People can be there sit and relax and cool down, but they are not recreation facilities. We're not putting on activities. We're not doing those types of things. The libraries we're working on coming online about, because again, libraries are not open right now. So again, how do we keep people from using the libraries and all the book materials, because they're not open to the public, and there are some public health issues that need to be sorted out for the guidelines. So, we looked at this originally. It looked like we were going to get through into June before we needed these. The weather changed, so we anticipated it. And this is really what I would call emergency response to a heat event. And the emergency response is we're going to open up facilities that we believe are big enough and to allow people to be there and we'll have staff on site, obviously, to ensure that the physical separation is there, and they'll be doing counts. And when the count gets near where the facility is at its maximum piece, then we'd have to work with people to finding an alternative location. But as I say, our historical work around these centers is that they're not the first destinations people are going to. So we'll see what happens this year, because I think a lot of the other traditional pieces that people would go to, malls and other areas, are not available. So this may be a year where we see that, and our folks are ready and willing to scale as we need to, and this will give us a good sense over this next couple of days. One thing I will say, just to add to this, is we still are not encouraging people to use buses as a cooling center and ride the buses for a chance to cool down. Buses need to remain for essential travel, and right now there's heavy restrictions on the number of people on buses. So please find your way. It could be that the bus is the way to get to a cooling center. That's fine, but if once you get there, we don't want people riding the buses as a cooling center. Access the physical locations, and we'll go from there. So we're adjusting as we go, and I would say that when people say, well, that's what's the plan? We've had to throw out the plans for what generally we do in a heat emergency, and we've had to revise those and do something very, very different given this weather in the next few days. And centers are going to be our approach now, and then we'll have to wait and see whether the traditional things of providing splash pads and extended hours and pools, whether those are the things that can work through the summer, when we expect we'll see obviously the more of these heat events coming our way.
And sorry, Paul, I'll follow up right where you left off there. And by the way, if you're sending out stats, if you do get a sense for other reporters about the number of usage in the past, I would like to hear that as well. But should people be bracing for a summer maybe without pools and splash pads, or is that really still all up in the air? I mean, I think people have been asking about the beaches as well with the trail open, but is that the sort of thing that people should just bite the bullet and assume that they're not going to be able to make use of?
I don't think assume through the entire length of time of warmth that all of those things would not be available, but there isn't a time frame around this. And so, when people say, hey, can we get those splash pads going up here? The warm weather's coming, let's go. And in the past, I know we've had these discussions with council about earlier starts to splash pads. It's not that we don't want to do earlier starts to splash pads. They are closed, and that order has not been lifted yet. So we'll see what happens through this week. But I think in the very short term, nobody sees heading back to those types of activities. As we get closer and deeper into the summer, we'll have to see what the guidance is from health officials provincially, and then obviously what Dr. Richardson has to say about that, because those are those types of things that we have to keep a very close mind of. It's obviously a gathering spot for one, but in terms of the pools and everything, it's all the other amenities that go with it. You don't just arrive with a certain number of people and jump in the pool. There are change rooms, there are washrooms, there are staff that are there are lifeguards that provide, obviously, on occasion, life-saving services to people that use our pool. So all of those things will need to be examined, and I think that that's a bit of time away. So that's why we've had to go with this approach right now. And there are normal things that would help keep people cool during heat alerts are not as readily available for us, and I don't think would be wise for us just to say we're going to ignore an order and do that. So we are where we are right now, Matthew, and I think as the summertime goes on, I don't want to say it's not going to happen. Elizabeth and I haven't had these conversations in great detail. I think we both agree that in the very short term, nothing's changing. But as we go through the summer, we'll just have to see how this is progressing in our community.
Thanks, Paul.
Thanks, Paul. With that, Mr. Mayor, that's the end of our questions. We'll pass it back to you for your closing remarks.
Okay, thank you, and thank everyone out there that's continuing to do the right thing. I think by and large in Hamilton, we're not seeing the kind of impact that we saw in a park in Toronto. And I know that the day after that, it was very sparsely attended. So they certainly got the message, and I think those kind of messages are certainly applying here in Hamilton as well. And even though we have a couple of folks that are deciding to take out their frustrations on some of our facilities, it is a very, very small minority, and the vast majority of our citizens are doing exactly the right thing. So thank you for all your good work. And we thank our sign language interpreters as well, Rosalie Bizzers and Georgia Whalen, Cable 14 and Bill Custers and their entire team, and Klein Media for helping us pull this broadcast together. And we continue to thank all of our essential workers out there, the paramedics, especially this week, for all the good work that they do, as well as all of our healthcare workers, police officers, grocery store workers, pharmacists, truck drivers, cleaning staff, and janitors, bus operators that are out there every day, making sure that people get to where they need to go, as well as food manufacturers that are putting food on the table for us that has to be produced somewhere, and they're doing that in their production lines. Firefighters and all the other imperative frontline workers, public works workers, people who are collecting the garbage. Every day they're out there keeping our city functional. We thank them all for putting themselves at risk and making our city functional and looking after all of our citizens. So thank you all very much, and we'll see you the next time we have a media advisory. Have a good one.